Want a strong core without risking your neck or back pain? Here are the top exercises to build some stability safely. In this video, I'll cover questions like, what's the #1 daily exercise for core strength? What quick ab exercises can I do without equipment? How do I avoid neck strain without doing any abs? Why is spine mobility essential for starting the day pain-free? How can I avoid throwing out my back while doing daily exercises like taking the trash out? These are all great questions, so let's begin. What's the #1 daily exercise for core strength? We all sit and stand throughout the day, and so the one exercise that sort of reinforces some of the important postural hygienes with hip hinging is very, very important. So what we want to do is we want to be sitting to standing and practicing standing to sitting, doing our hip hinging, basically vice versa. So love doubling exercises with my daily routine, and it looks something like this. You're going to be sitting, let's say you're sitting on your chair and you're about to get up. What you want to do is you want to keep your spine neutral, hinge forward, and use your butt and your legs to get you up, and then bottom forward with your spine nice and neutral. When it comes to sitting down, you want to be hinging forward, keeping your spine nice and neutral, lowering yourself and sitting down just like that. In this exercise, you want to make sure that you keep your knees nice and stable. So as you're getting up, I'm going to show it facing the camera. You're going to keep your knees not going in or out. You're going to keep your spine neutral, getting up, not letting the knees go in and out. Maybe at the beginning, you want to practice placing your hands in the middle portion, pushing them out to kind of encourage pushing in and keeping pushing in and pushing out. Equal forces keeps the knees in place, and that's what you are practicing. So the next question is, what quick ab exercises can I do without any equipment? I'm going to show you the very basic ab activation exercise, which is toe tapping. We all did it as babies. So what you're gonna do is you're gonna lay down, keeping your spine nice and neutral. You're gonna close the gap in the small of your back. You're gonna breathe biologically, pushing, so you're breathing in through your nose, out through your nose. As you breathe in, you send your abdominal diaphragm down towards your pelvis and pushing your sides out, keeping that gap closed. You bring one leg up, bring the other leg up, and as you're maintaining this, which is all being done by the front lower portion of your body, working with the back to keep your pelvis neutral, you're going to go down and tap back and forth. I do this exercise quite often in a lot of different videos I've done because it's so important, and we tend to skip the important things in an attempt to want to jump in and get excited to do something else. But the reality is, if you don't have the basics down, it's hard to build over a foundation that's not strong. So when you do this exercise, which is basically for your abs, you're gonna avoid hurting your neck, right? Do you see how your neck and your abs, when you do the ab workout, they don't need to get hurt? That's the reality of it. So abdominal crunches is one of those exercises that people do, and one of the main issues I have with abdominal workout. We're fully mistaken when we do sit-ups thinking we're working out our abs. When you lay down on your back, you're practicing activating the abs by keeping the spine neutral and holding the legs up. You condition your abs, so then as you advance in your developmental exercises, the exercises we all have done as babies, and in fact how we went from helpless infants to running toddler stage without any weights, bands, or gyms, we can then do what is necessary, and we're able to up the challenge by doing what we did at about age 7. So you've already done your abdominal exercises, you practice it, and now you're gonna go to age 7 months, and it looks like this. Another great ab exercise. So you're gonna be on your back. By now you have practiced and built your stability in your trunk, and you're gonna go just like this, keeping the spine nice and neutral. This is a little bit more advanced. So I'm gonna rotate towards the camera and go diagonally up, keeping this rectangular. Now in going back, you can see that I can press on my elbow to initiate lifting things up. I'm not pushing my foot down to try to rotate. I'm pressing on my elbow or my forearm, and I'm keeping my trunk nice and square. By pressing there, because everything's connected, I'm able to rotate away. This is all my abdominal, my rectus abdominis and my obliques stabilizing. All of my abs are stabilizing. Now I can go a little bit more and still maintain that. When you have the right connections, you're stable. Now I can go even farther and maintain that, as you can see. And now I can go even more. It's a little bit more challenging, but it's not impossible. So this is what you did at age 7 months, which is crazy, isn't it? Now, what do? We do ab crunches, we do all these, transverse abdominis. Basically, I'm gonna call it wasting time. Circling back to the question, you avoid neck strain by doing the right abdominal activation exercises. It does not involve your neck. Your neck is not the one that's initiating the move. So let's go to the next question. Why is spine mobility essential for starting the day pain-free? Well, that's pretty simple. Our mobility requires our spine to have the 33 segments that it has. When there is a glitch, this is the beginning of dysfunctional patterns of movement, which over time, basically coupled with other things that we do without realizing, like using our devices, having, basically compounding negative effect on our body, using devices, computers, phones, whatever. This first shows up as minor pains and aches, for that matter, then turns into irritation of the nerves, disc, and joint spaces, and then turns into things like osteoarthritis. We blame our age for it, but reality is we're seeing these negative changes in all ages, as early as late teens and early 20s. So it's not the age thing. It is the habit and lifestyle choice thing. Now, finally, we get to the last question. How can I avoid throwing my back while doing tasks like, taking the trash out? It is important to realize that your lower back is not responsible to pick up the whole weight of your trunk. Then you bend it, twist it, and do other things to it and expect it to endure all those things. Obviously, that's not happening. Your lower back works with your lower trunk. That is your abdominals, including the obliques, your legs and glutes, to provide support and stability. When a task that is to be performed by a group is given to one muscle, we're bound to have issues. So instead of bending, if we hinge at the hips, so let's get up and do the hip hinging together. So if we keep the spine nice and neutral, meaning the whole front of my body and the whole back is working together, and I hinge forward and I get up, it's not my back that's doing it, it's my glute that's doing it. We're giving the task of supporting the trunk to the group in charge versus just one muscle group. That's why it is important to bring the whole concept of sitting to standing properly into our profile of movement so it becomes automatic. Hope that this video was helpful. It helps me if you take the time to like and comment so others get to watch this video as well. Thanks for subscribing to the channel and thanks for watching. Until next time, take care.